All right, Morning Blend viewers, guess what? I'm here. I'm hooked up to my IV drip, getting IV therapy. I'm here at Health Hydration Oasis, H2O, again with Dr. Fox. This is cool. You're a doctor of anesthesiology. It's hard to say.
It is.
What's interesting is, so you hooked me up to this a minute ago. Mm-hmm. First of all, let's talk about the IV, because I think what people are nervous about is the needle.
Yeah.
This is like an infant size. I thought it was going to be a big thing. It's so tiny.
It is. We actually do put this in like newborn babies. That's what we do. So if you have kids that get surgery, like age 1 or 2, this is the exact same size IV they'd be getting.
You gave me a cold spray first, like when we talked to Julie and Rob, so I didn't even really feel it at all.
Perfect.
I didn't. You're like, big pinch. I'm like, there was like no pinch.
Okay.
I didn't feel anything.
Right.
And so now I'm getting an IV. What exactly am I getting in my therapy bag?
Yep. So you also have an Invigorate. However, as we said, we've customized it for you. So I know that during your health history, you were recently sick, cold crud stuff. So we put in some extra vitamin C, we put in some zinc. So similar to some of those products you can buy, little pills or shakes with, fighting off cold, except that we're giving it to you IV so that it will actually get in and work.
Okay, so let's talk about that, because when you talk about taking a pill, I take my vitamins every day. I'm a gummy girl, but here's the deal. If your vitamin, I love the look on your face, like, okay, wait to hear what she's gonna tell you. So if your vitamin level is roughly here, explain to me and everybody out there what you told me in terms of how these vitamins work versus an IV bag.
Okay, so most people don't realize that the body is only able to absorb what's in a pill, about 20 to 30% of it. So let's say you need to be up to here. When you take a pill, it actually only gets you up to maybe about here.
That didn't move much.
It didn't move much. And then life goes on, your kids at soccer practice, blah, 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 Starbucks, whatever, and then you're going back down.
Yeah.
But when you get something IV, we are skipping the stomach, the gut, all of that issues of absorption, and it's going directly to your cells. So when you go from here, you actually tank all the way back up. And that's what we provide here as a way to refuel yourself. We say from the inside out,
yes.
So that when you do continue to take your gummies and all that, instead of dropping all the way back down, maybe you're just here or so, and that's why people feel better.
It's great. I mean, I like, again, I can't feel this going in my arm.
Perfect.
None of that stuff right now. I just feel great. So it's nice, super relaxed. But you, as you mentioned earlier, you're a true physician's office.
Yes.
Do you accept insurance?
Yeah, so we're actually currently credentialing for insurance, but all the major PPOs. We are able to accept people's HSA, their health savings accounts, as well as their FSA, their flex spend. So that is now. So if you got it, it's the end of the year, this is a great way to utilize that. And
tell everyone again who benefits, because I know when I talked to you about my medical history, I said, like you said earlier, I had surgery earlier this year. I've been sick since then. Mm-hmm. You know, we went through all these kinds of things that you could truly tailor what I'm getting inside of my IV therapy, but who else again benefits? I know you mentioned a few earlier, but I just think it's good for everybody to know.
Sure. First off, I just want people to know that you don't necessarily have to be sick per se to get one of these.
You can be fully healthy.
You can be fully healthy. This is just another way, we think of a smarter way to maintain your health and wellness.
Yeah.
So, but yes, GI stuff, so Crohn's disease, ulcerative colitis, those gastric bypass patients that we talked about,
gluten
intolerance, those people are just not able to absorb things, and so they're living a chronic state like that. Chemotherapy patients, they feel icky, they're not able to eat as well.
Yeah.
Even some of our elderly patients, they're just not eating all the things maybe they need to. Energy is running a little bit low. Migraines, so don't stay in bed fighting off a migraine, not eating and drinking all day. Come see us and let us help you out.
I told you both, my boss and Molly both get migraines. They both want to check this out. It's so cool. How often can you get this done?
Yep, so depending on what is wrong with you, what's your medical condition, some people actually come in a couple times a week. Our cancer patients do that, as opposed to someone who's young and healthy, say like yourself, maybe once or twice a month. But it all, again, depends on what your particular issue is, and that's why we again say it's tailored to you.
I just tasted the vitamins.
Perfect.
So great. That is so cool. Awesome. This is so wonderful. You're having this great special offer for Morning Blend viewers. I'm telling you, firsthand, you got to come in and try this. You can win a drip party for you and 3 of your friends. Go in that group party room, right? Get it for you. It's Friday, December 8th. It's going to be at 6 o'clock. To enter, go to hydrationoasis.com/contest. then click on the Facebook button right on that page. You can like, share, and comment to be entered, but visit online. It's Health Hydration Oasis H2O, which is hydrationoasis.com. You're right here on West Greenfield Road in Brookfield, 262-277-1018. Call and make your appointment today. It's so awesome here. You're going to learn so much and experience wellness from the inside out. Prevention is key, right, Dr.
Correct,
Fox?
absolutely.
Thank you so much.
No, it's my pleasure.